Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about 10 signs of uncontrolled diabetes. So if you like the video related to my health, my way, would like to request you all, please do subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. 10 signs of uncontrolled diabetes. Diabetes can impact a person's quality of life, and if blood glucose level remain high, it can also be life threatening. Managing blood sugar level can reduce the risk of complication. People who do not manage their diabetes are at risk of dangerously high blood glucose. This can trigger a cascade of symptoms, ranging from mood changes to organ damage. A diagnosis of type 1 diabetes usually happens in childhood. In this type, scientists believe that the immune system attacks insulin producing cell in the pancreas, and the pancreas can no longer produce insulin. The symptoms often appear suddenly. Type 2 diabetes is more common after the age of 45 years, and symptoms appear gradually. Many people do not know they have type 2 diabetes, and so they do not take measures to manage it. In type 2 diabetes, the body cannot use insulin properly. In time, it may stop producing insulin. Insulin problem can cause a person to have too much sugar in the blood, and this can result in a number of complications. The Centers for Disease Control and Prevention estimate that in 2015, nearly 25% trusted source of people with diabetes in the United States did not know they had the condition. A person who recognizes the signs and symptoms can getting an early diagnosis and take action to prevent complications from arising. The following are the signs that a person needs help with their treatment for diabetes. Anyone experiencing them should consult a doctor promptly. High blood glucose. High blood glucose readings are the most obvious sign that diabetes needs attention. When a person works out their treatment plan with their doctor, the doctor will advise them on their target glucose level. These can vary between people. The American Diabetes Association note that healthy blood sugar levels are usually before meal 70 to 130. 2 hours after eating, under 180 mg. The correct use of diabetes medication and lifestyle changes can usually bring blood glucose within target ranges. If blood glucose remains too high or if it is steadily rising, the person should speak to their doctor as they may need to adjust their treatment plan. Now I'll be talking about the frequent infections. High blood sugar level can increase a person's susceptibility to infection. A person should see a doctor if they start to have more frequent infection or if they take longer to recover from a wound or infection than they did before. A study trusted source published in 2018 notes that people with diabetes have a higher risk of skin infection such as cellulitis or ulcer, especially on the feet, urinary tract infection including cystitis, mouth and gastrointestinal infection, respiratory tract infection such as tuberculosis and flu, yeast infection, for example, thrush ear infection. Yeast feeds on sugar, and so the combination of lowered immunity and high blood glucose makes people with diabetes particularly at risk from frequent yeast infection. Infections that occur with diabetes take longer to heal and can worsen more quickly than in other people. Without prompt treatment, sepsis, a life-threatening complication, can develop. Ulcer, for example, on the foot can lead to tissue death and possibly the need for amputation. People should check regularly for skin changes and seek medical help as soon as they have any signs of an infection. Now I'll be talking about increased urination. Frequent urination or polyuria is a common sign of both type 1 and type 2 diabetes. Polyuria happens when a person urinates at least 3 liters per day. This happens because the body tries to rid the blood of excess glucose when sugar levels are high. People also drink more frequently, causing them to produce more urine. Now I'll be talking about increased thirst. People with diabetes sometimes experience polydipsia, an extreme form of thirst. This is common trust source in type 1 diabetes, and it can also also occur with type 2 when blood sugar levels are very high. High blood glucose can result in dehydration and thirst. It can reduce the body's ability to absorb water. A person may experience an overwhelming need for water, a chronically dry mouth, dizziness. Even when a person drinks more fluid, dehydration can occur. Now I'll be talking about diabetic ketoacidosis. Dehydration can contribute process source to diabetic ketoacidosis, a life-threatening emergency that can arise when the body cannot access glucose for energy and it starts to break down fat instead. Ketones are a byproduct of this process as they accumulate in the blood. They can make the blood too acidic. Now I'll be talking about the symptoms of diabetic ketoacidosis, which includes dizziness, nausea and vomiting, confusion, abdominal pain, fruity smelling breath, a loss of consciousness and possibly a diabetic coma. People with diabetic who experience symptoms of diabetic ketoacidosis need immediate medical attention. Diabetic ketoacidosis can be fatal and it needs emergency hospital treatment. Now I'll be talking about appetite increase without weight gain. A person with diabetes may have high blood glucose level, but their cell cannot access this glucose to use it as energy. This happens because the body either does not produce insulin or cannot use insulin correctly. Insulin is necessary for processing glucose effectively. Even if a person has high blood sugar level, their body may lack energy. This can lead to polyphagia, in which the body triggers hunger sign as it tries to gain access to fuel. Even when a person eats, the hunger may persist as the body continues to ask for fuel. Although there is a link between obesity and type 2 diabetes, people who have difficulty managing their diabetes may not gain weight even when they overeat. So that's all about the diabetes in this video. I hope you all liked it. So I'll definitely come with the next video with my another content. Stay home, stay safe, take care of your health. God bless you. Bye bye and take care.